Good afternoon, Johanna. This is my presentation for our medication assignment. I have constructed a poster board here with some information throughout, and I'm also using my brain model demonstration. The drug I chose was Adderall. The brand name is Adderall, and the chemical names, because there are two stimulants in this, is dextroamphetamine as well as amphetamine. I've also included the pronunciation right there. Adderall is used to help people with attention deficit hyperactivity disorder, or ADHD for short. ADHD is a common mental disorder that affects children and their ability to pay attention, control their behavior, and things such as like sitting still. It is very common in children and teens and can continue into adulthood. ADHD currently cannot be prevented, but it can be managed with education and medications such as Adderall. The description of Adderall, like I said before, is a combination of two drugs. So it's a combination prescription drug that contains amphetamine and dextroamphetamine. These two stimulants affect the body's impulse control and hyperactivity. Adderall is a stimulant medication in the amphetamine class. It contains 75% of dextroamphetamine and 25% of levoamphetamine. These drugs increase activity of two primary neurotransmitters in the brain, the norepinephrine, referred to as the stress hormone. It increases your heart rate and blood pressure, and it also increases dopamine, which is responsible for pleasurable sensations and motivation. It triggers the neurotransmitters in the prefrontal cortex, which is around this area right here. That area is responsible for executive functioning, thus improving your concentration and focus. The routes of administration are here, which is oral. Adderall is usually taken by mouth. It can be abused. I've kind of read about it, and some people do snort it. I wasn't sure if I should put that on there, but that is something common that people do. So I've also included the origin and history of Adderall. A Romanian chemist named Lazar first synthesized amphetamine in 1887, but researchers couldn't find any practical use for it at the time, so it was like forgotten and left for around or over 40 years actually, until the American chemist Gordon Alley's revisited the same compound in an effort to develop a new asthma medication. So Gordon had tested 50 milligrams of this new drug on himself, which was 5 times more the standard dose of today. Gordon reported feeling heart palpitations, feelings of euphoria, and he also mentioned having a rather sleepless night. It soon became apparent that amphetamine had little effect on asthma. Its stimulant properties made it popular for many other uses like weight loss, depression, and it was also used as energizing pep pills for soldiers in World War II. Today, amphetamine is used for ADHD and narcolepsy. The brand Adderall, you could probably find it down here. It was made in a tablet form. It was introduced in 1996 by Richwood Pharmaceuticals. It was first introduced as a quick release tablet, as I mentioned, but was switched to Adderall XR, which I have pictured here, in 2001 as an alternative to the quick release tablets. So Adderall XR is now a slow release capsule, which produces longer effects. So down here on the bottom, I've also included different types of Adderall. When I was younger, I was prescribed Adderall, so that's kind of why I found it like most interesting. I know like it changed over the years a lot, but when I was taking Adderall, I was taking one of these when I was a child. So it was just kind of interesting to me to see like the different forms and the doses that they have and have switched out throughout the years. Which brings me to my next topic, which would be the dosages. Doctors usually start out patients with a lower dose. The recommended dose for children is 2.5 milligrams once daily and 5 milligrams once or twice daily for adults. I do know that they start you off low, and then if you're having a hard time or your body is like getting used to it, then they up your medication. They have changed it a lot lately, just with how much they're like giving people. So it really depends. The side effects for Adderall are loss of appetite, weight loss, dry mouth, upset and like painful stomach issues, nausea, vomiting, dizziness, headaches, diarrhea, fever, nervousness, and trouble sleeping. Adderall can also cause trouble breathing, chest pains, hallucinations, and aggression or paranoia. Major side effects, Adderall could possibly cause strokes or heart attacks, which is kind of scary, but it's understandable with it being a stimulant. Like if you have heart problems or something to begin with, it's probably not your best bet to take that. So the toxicity, it was kind of hard finding information that I wanted to present with this, but according to my research, toxicity levels of Adderall have been reported with doses ranging from that 1.5 to 20 to 25 milligrams of weight. So for instance, a 90-pound person would have to take around 820 milligrams to get those toxic levels of this drug. Similar drugs, which I wish I would have had on my poster board, would be that Vyvanse or Ritalin, which is a methylphenidate. They're like kind of common to Adderall. I know they're like right up there with it. So down here, it is a Schedule II drug. Adderall is legal, but it's considered dangerous because of the high risk of abuse and dependence. So I put that there. It is very highly addictive. I'm grateful that I was off of it before I got older, I guess. Cause yeah, I was doing my research and just how easy it is to become addicted or dependent on it is kind of scary. So it also does have a black box warning, I read. I'm not sure when they changed that, but they do have a black box warning now letting you know that it is highly addictive. So I put the effects on pregnant women and their unborn child. Babies born to mothers taking Adderall in pregnancy are at a very increased risk of premature delivery, low birth weight, and withdrawal symptoms, including agitation, dysphoria, laziness, and poor feeding and growth, which can affects the child. Like, the effects on adolescents and children. Adderall is known to help children suffering with inattentive presentation, which I put right here. You know, he's kind of not paying attention to the teacher. He's just kind of daydreaming. He's having trouble paying attention. And it is also known to help children with hyperactive impulsive, which is over here, or it's used for a combination of both. The FDA has received hundreds of reports of aggressive behavior during the last 5 years in children taking Adderall. What should our clients be aware of when taking Adderall? Personally, I feel it is very, very, very important to let our clients know how addictive this is. It can lead to substance abuse issues. It's more abused by college students, which I have right here. That's why I wrote the study drug up here, because that's kind of its nickname out there, is like a lot of college students use this when studying. I've also seen that high school students, it's very common in like 10th grade and up. They're just using it to aid in studies and things like that. Does race make a difference? No, it does not make a difference. This drug can be given to anybody, and anybody can become addicted off of it as well, and it can help anybody as well. I know it's not just a horrible, bad drug, but just the risks that come with it kind of make me not look at it like I did when I was younger, because it did help me, honestly, but I'm not sure if like I would recommend it to like my family or anything like that. So some other information that I think should be known is that Adderall is one of the most commonly prescribed stimulants. So like I said, when I was younger, I had used it. It was kind of like sad, because I went to see my doctor and just let him know that I was like having trouble in school, you know, and I wasn't even in there for 5 minutes, and he was like, "Oh, I have something for you. Just try this and let me know how it goes." And I went. It kind of helped, but not really. So I let him know that, and he upped my dosage. Again, it kind of helped a little bit, but it wasn't working. Upped my dosage. So by the time I was getting off of it, I was at 120 milligram in the morning, or no, 220 milligrams in the morning, and then another 20 at around lunchtime. So I was taking a total of 60 milligrams of Adderall down here, these 20s. And that, to me, being a 13, 14-year-old, is ridiculous. So I guess the main information I would just like to point out is that starting out low, and maybe that's why they changed the milligrams for what they recommend now. Overall, I think it is a very useful drug for children and just people really struggling with these types of issues, you know, not being able to pay attention, acting out, aggression, but you just really have to watch out for it being addictive, the side effects, and just signs of addiction, honestly. yeah, I hope you like this. I'm trying not to go over 15, but here we go. Thank you so much.